Are you dealing with foot pain and struggling to walk, play with your kids, play a sport, or even work, and you're tired of the pain that you're dealing with and you don't want injections or long periods of rest or even surgery? Hi, I'm Dr. Kevin Christie, and today in this video I'm going to describe plantar fasciitis, which is a common type of foot pain. There are other types, but we're going to really focus on this one since it's so common in our population, especially runners and active folks, or if you're sedentary and an increased BMI, you can also deal with this as well. And sometimes walking barefooted at home is a problem, running, walking, the gym, a lot of different issues with this. We see it a lot in our office, and as chiropractors, you may not realize that we examine and treat this. And today in this video, I'm going to give you a couple stretches and exercises to do to help prevent this. And I'm going to show you what we do to evaluate and treat plantar fasciitis in all types of people. So when we're dealing with foot pain, we really want to make sure what's going on here, rule out anything else. But let's assume we're dealing with plantar fasciitis. A lot of times we're going to have pain right here where it inserts, but it could also span the entire foot. And so we're going to make sure that we evaluate that whole process. A lot of times you've heard of having a heel spur, and you might have had an x-ray to diagnose that. This is a little bit different than having a heel spur, but a lot of times a heel spur and plantar fasciitis will be associated with each other. Even if you have a heel spur, we can treat plantar fasciitis by really working on the foot and all the way up into the calf. So one of the things that we do during our evaluation process is to check the motion of the ankle to see if there's flexibility in the calf and the ankle joint itself. Okay? I'm going to go through a quick little joint assessment, because when we're dealing with this, it's not just the muscles. It can also be joint restrictions in this ankle joint, or even in this big toe, the first MPJ they call it. A lot of times they'll lack extension in here. So I want to see how that's moving. And I'm just checking the motion within that joint segment right here. And then also I'm going to check the ankle and into dorsiflexion as well. And we would do some functional testing to do that. You can see a little tight there. And so we want to figure out, is that tightness coming from the calf or from the ankle? And here, it's more for him, it's the calf, but I'm going to show you just a quick little ankle manipulation we would do if it was restricted just like that. And you'd hear a little bit of a cavitation there, and then we would also do a little manipulation into the joint here if there was an issue. He doesn't have an issue there, so I'm not going to do it. So that's us assessing the joint component of this. And then I'm going to get into the plantar fascia and see if there's any scar tissue in there. We can actually check that. With the active release technique training we have, we can tell when there is some scar tissue or issues in the muscles and tendons, and he's a little bit tight in there. And so I'm going to show you a little bit of the active release technique motion. We're going to get in there and really loosen up and release that plantar fascia, which is, kind of a combination. There's some muscle in there, but there's also a pretty long tendon. You can tell when you pull someone's foot like that, you can see that rise up there. You can check that on yourself. That's going to be the plantar fascia. So we're going to really get in there and try to release that, because oftentimes the pain's going to be in there, but what's happening is this fascia here is tugging on the insertion, and then where the calf plays in, it's like a pulley system. If this is tight through the Achilles and the calf, it's going to pull like that, and then it's going to pull the plantar fascia taut like a pulley does. And so we really want to make sure we get this whole posterior chain all the way through there in our work. And so we're going to get in there and really release that through the active release technique, which is shortening and then lengthening, getting a thumb contact in there. So it's different than massage where you just kind of rub the musculature. We're getting in, keeping a fixed contact and letting the motion do the work with our thumb underneath it. We're going to really release that foot, and that's going to help get some blood flow in the area too. We'll get right into the attachment site, just like that. And as I mentioned, we really want to check out this whole calf area back here. And so oftentimes this is tight. And so we'll do some active release technique in there, but we'll also do something called GRASTON technique, which is a stainless steel tool that's got a beveled edge. And I'm going to use a little bit of an emollient in there. And I'm going to really try to release this calf, because as I mentioned, that Achilles gets tight, it pulls that way, it pulls the plantar fascia tug, and it just gets real tight right there. So I'm going to get in there, and as I'm doing this, I'm going to get him into some ankle motions and try to really loosen that up. So anybody that's coming in our office with plantar fasciitis, one of the main things we target is this whole calf area, and a lot of people miss that. And what's cool about this tool is we can feel some of the gristly feeling that we want to work on as scar tissue oftentimes, and we're trying to get some motion into there. So I would do that for a few minutes, and then we're going to get, with this tool, I like to get right on the spot where a lot of times the pain is, and there's usually a lack of blood flow in that area, so I'm going to get right into that insertion area and try to get some blood flow right to there, which will help with the healing process of this. So when we're treating plantar fasciitis, we're going to do kind of equal parts joint manipulation where needed, soft tissue muscle work, some deep tissue laser therapy I'm going to show you, and then definitely some corrective stretches and exercises. Good. And so that's how we do the manual therapy for plantar fasciitis. There's a lot of different variations sometimes, and we would take that in consideration during the evaluation, but this is how we typically treat it. With a lot of our plantar fasciitis cases, we like to use deep tissue laser therapy. Laser therapy, or class 4 laser therapy, has been shown to really help stimulate the healing process. Every cell in your body has the ability to heal and turn over and replicate, but sometimes it loses that tug of war battle with the stress placed on it. And so the laser actually stimulates that cell to heal at a faster rate. And so we're going to get into the areas of a lot of foot issues, elbow, wrist, shoulder. And so on plantar fasciitis, we're going to get right on that attachment, and we'll spend about 3 or 4 minutes on the complete foot and ankle during a plantar fasciitis case, and we're going to try to get in there. Again, we're trying to stimulate and increase the healing rate of this area. You won't feel a whole lot in there. There's not going to be any type of heat or warmth, but it's really helping the cells heal at a faster rate. So we'll get right onto that area where the attachment is, and then all the way through the plantar fascia into the foot, and try to help speed up some recovery. I'm going to show you a couple stretches and an exercise for plantar fasciitis that you can do at home by yourself, very safe. These are beginner level exercises. In our office, we tend to get to intermediate and advanced, but I don't know your particular situation, so I can't give you advanced exercises. But the ones I'm going to give you today can be really helpful in preventing foot pain or help managing the moderate foot pain that you may have now. And so first one's just going to be a nice foot stretch. You're just going to cross over the affected leg there. You're going to take your, say in this situation, your left hand and hold that. Then what you're going to do is try to just grab the toe and the ball of the foot there, and you'll just pull with a nice stretch just like that. And so I'm getting a good stretch right along that plantar fascia, and my ankle is dorsiflexing that way, and I'm getting a stretch on my calf Achilles area. So hold my heel there, and then just a nice stretch. You can hold that for about 10 to 12 seconds. Do both feet, and you can do a few sets, and you can do that a few times a day, in particular when you wake up in the morning, which is a common time where the foot will be more painful and a little more stiff. Here's a great exercise for the foot. We always want to try to build up some resiliency when we're dealing with an injury. There's going to be the load and strain you put on the foot, and then can you strengthen it enough to make it resilient and really defeat the stress placed on there. And so we're going to do a nice eccentric foot contraction. I want to get a towel there that's raised up so that my toe and ball of the foot are there, and then we're going to get to there, and it's going to be a single leg, and we're going to lower all the way down, and then we're going to come all the way up onto that ball of the foot and the toe, and you should feel that contraction in the plantar fascia. The towel is there to be raised up a little bit so that we get the full extension of the big toe that really helps in this strengthening exercise. And I want you to go at about a 3-second contraction as you raise up and as you go down, just like that. And that'll help strengthen the foot from a beginner level. Now that you've seen how we evaluate and treat and give prescription of exercise and stretches for foot pain, in particular plantar fasciitis, if you'd like to get evaluated and treated on the same day and be given a treatment plan to help solve your pain, call us at 561-997-8898 and we'll get you in right away for an evaluation and treatment.